Hi, sorry, the last part of my video got deleted. So we're going to go into the impression and plan for my patient. So this is a 10-year-old female who presented with 30-pound weight loss over 3 months, tachycardia, lethargy, blurry vision, and headache, who was seen by her primary care doctor that consulted an endocrine service for unusual thyroid labs that were sent, which was the undetectable TSH and highly elevated T3 and T4. The most likely etiology of her hyperthyroidism is Graves' disease. Graves' disease typically has an onset and duration greater than 6 to 8 weeks, which was normally seen with the Hashimoto's thyroiditis. They both come in presenting in the same fashion, but Hashimoto's thyroiditis typically lasts 6 to 8 weeks, and this patient's symptoms have been presenting for longer, more like 3 to 4 months. So Hashimoto's thyroiditis is less likely, and Graves' disease is more likely. In order to be able to diagnose with the Graves' disease, we will send more labs, including the thyroid antibodies, specifically the thyroid stimulating immunoglobulin. If that does come back positive, then we will follow up with the family and let them know she has Graves' disease and progress with further management and symptom management. If the thyroid antibodies are negative, then we will order a technetium scan, which is the radioactive iodine uptake scan of her thyroid to see if there are any nodules. This any type of thyroid nodules are less likely, as we do not palpate any on exam, but there are nodules that you cannot palpate, and that's why the test would be valuable for that. Then our last and most least diagnosis would be an ingestion of any type of thyroid stimulating medications. The patient and mother do not endorse anybody in the family taking those types of medications, and that they have access to medications like that, so an ingestion is less likely. So my plan for this patient is we're going to send her to the lab today to get the thyroid antibody tests done. I also start her on some medications. She will be started on prednisone, a 5-day course. She'll take that 3 times a day. The 5-day steroid burst will help minimize any of the inflammatory response with the hyperthyroid and help her with her symptoms. I will also start her on propranolol. She'll take that once daily for 4 weeks. The propranolol is good in treating the symptoms associated with hyperthyroid and Graves' disease. So for the tachycardia, the tremors, that should help with the symptom management. And then I will also start her on the methimazole. She'll take that 2 times a day in the morning and at night with meals. That should help kind of minimize the hyperthyroid for now. If her labs come back, well, depending on how her labs come back, we will update the family, make any modifications to the plan. Thank you.